We're back with Grazel and on a potentially sensitive topic this time. Um, I guess we'll just dive right in. Have you got any experience with narcissists in couples therapy, Grazel?
Yes.
Um, so, how do you actually define narcissism? Because I feel like that in the cultural zeitgeist, there's a whole idea that as soon as you say anything that's remotely self-centered, you are a narcissist. So, what is a narcissist?
Right. Yeah, I mean, it's a great topic, right? And there's so much information online about narcissism, but I think what's important is really understanding the difference between a normal and adaptive narcissism versus a pathological narcissism. Pathological narcissism is mostly related to unrealistic, inflated self-esteem. There's an entitled expectations about their careers. There's also an investment in self-development over connection to others and an indifference. There's an indifference. This is the most important part, is there's an indifference to the welfare of others. They don't really show care, or they can, but it's self-centered. But there's very minimal to zero expression of care to others.
Okay.
Adaptive narcissism, normal narcissism, is a person where they're able to understand their value and other people's value of themselves. They're not dependent on fame, preoccupied to success. They're more, there's a healthy self-assessment about their success, and it's practically the opposite of the definition of pathological narcissism. There's no inflated self-esteem. There's a great balance of self-esteem. There's a great value of themselves that's not taking over other people's spaces. There's empathy, there's care for others. But also, they feel confident about who they are without harming other people.
So that sounds like adaptive narcissism is actually a good thing for the individual. It's not harming anyone and it's actually serving them quite well. Would you agree with that?
Yes.
Okay.
Absolutely. And it's helping other people too, right? Like those are the people that are able to share their successes with others because they want others to also succeed. Narcissism is the opposite of that. It's all about the self-centeredness.
Mm.
That's a harsh word, but that, it's the definition. It's part of the definition.
Yeah. Okay. Um, so when there is a pathological narcissist in therapy, are they usually the ones that have initiated going to therapy, or would it be their partner because the partner has some concerns?
That's a hard one. So it really depends. It really depends on the presentation of the couple. Pathological narcissism, they don't, if there is a person with pathological narcissism, they don't usually go to therapy. So they will
Because they don't
refuse
feel
therapy.
like they have a problem. Is that kind of the thing?
Yes, or the times in which they will go to therapy is to say something like, I haven't really learned about myself in the last, or I haven't really learned about, this is just something like probably what a narcissist would say is if they go to therapy, I haven't learned anything new about myself that I don't already know. I just need you to be able to guide me in my stressors. And that's all I need. So usually it's more like because they already know everything about themselves and they know everything about the world. And also, there's nothing wrong with them. So most of the time, they don't go to therapy. And if they do, it's about just guiding them. They don't really need to learn from the therapist because they already know a lot.
Okay. Um, Now I imagine in a relationship, you've got a narcissistic partner, you've got a non-narcissistic partner. There's probably a discrepancy in how safe they both feel in the relationship. So, what do you do as the therapist in the room to encourage that sense of safety for both parties?
That's a tough question. If they're in a narcissistic abuse cycle, there's only one partner that feels unsafe,
Okay.
which is the person that doesn't have narcissism.
Mm.
So, in a narcissistic abuse cycle, as a therapist with domestic violence training, for me, I'm able to assess whether that abuse is related to the narcissism.
Hmm.
If it is, I wouldn't recommend them to go to couples therapy. It would, the narcissistic person would recreate the narcissism abuse cycle in the room
Hmm.
with the therapist in the room with them. It's not helpful. This is when couples therapy is contraindicated. So if they are partnered with someone who has a pathological narcissism and it's pulling them to go to therapy, before they say yes, the one partner that doesn't have narcissism need to be in individual therapy of their own on their own and make sure that they process that with their individual therapist to see if it's even going to be helpful.
Hmm.
But they need to be able to see someone who has a specialty in treating a narcissistic abuse cycle.
Yeah, that was going to be a follow-up question because if you have a pathological narcissism, is it possible for you to work your way out of that through self-work, or is that just kind of who you are and that's it? Because then it's not just like couples therapy is contraindicated, relationships are contraindicated because you can't safely be in one because of who you are and how you view the world and how you view yourself. So is there kind of a way to get rid of a pathological narcissism?
Absolutely. I think as long as they realize that they want to create that new change in themselves.
Hmm.
And they can definitely work with therapists who specializes in narcissism. There's different treatment modalities for that, right?
Hmm.
And there's therapists that are trained to help them. But most of the time, people with pathological narcissism don't really go to work on themselves in individual therapy until later in life when they realize all of their relationships have failed and felt empty.
Yeah, it gets to a point where you have to look at yourself because it's like this just keeps happening to me, and the only consistency is me. Um,
Yes,
okay.
right. Right.
Um, so let's say someone's in that situation and they're a pathological narcissist, but they're starting to realize, okay, then maybe I'm the problem here. Is Can couples therapy actually be effective in that person when someone really struggles with empathy and accountability, but they're open to trying and that you can see there's an effort on their part?
Absolutely. I think any small opening can create safety for the other partner. Yes, we could definitely help them. I would suggest that they continue, the person with narcissism continue to engage in their own individual therapy work so I can coordinate treatment with their individual therapist to aid my couple's treatment with them.
Hmm.
So absolutely. As long as they're open to looking at how their pathological narcissism traits negatively affects their partner and their actual relationship, yes, they're welcome. They're welcome to come see us and any other therapists.
Yeah.
Yeah.
Well, thank you for that. That's been such an interesting topic to cover. Um, and yeah, what would you say to someone if they think that their partner might be a pathological narcissist? What would you say to them as a way to handle that situation?
I would be very direct and honest and provide psychoeducation about um, if they're in a narcissistic abuse cycle and it's starting, I would tell them, please find your own individual therapist and work on this and learn about narcissism and the impact it has on you.
Okay, great. Well, thanks again for your time. We'll speak again soon.
Okay. Bye, Scott.